So we're looking at part 12 here, the theory and practice of hydrotherapy, an ongoing series on the theoretical applications and application of hydrotherapy procedures. So just a reminder that whenever you're navigating a health challenge, you want to partner with someone who has a similar philosophy of care of the human body as you do. And anything that comes along that they might suggest or you might discover, that you check it out thoroughly before just jumping in and applying it. Back in January of 1903, Thomas Edison stated that the doctor of the future wouldn't be giving medicine, but would be doing teaching of the patient to care for their body and what they ate and what causes and prevents disease. And that was also the basic outline of some counsel in 1885 about the healing art and only one way that heaven approves. And they're just simply the simple agencies of nature: pure air and water, cleanliness, proper diet, purity of life, and a firm trust in God. But they take time to develop and to apply. And many people have lost that art or aren't willing to put the effort in to do it. And 3 John 1 verse 2 reminds us that our soul also needs to prosper, and that is a direct link to our health and other areas of prosperity. And Romans 12, 1 and 2 just reminds us that it's our reasonable service to present our body as a living sacrifice, which is perfect and blameless, blemishless, without spot or wrinkle, essentially. And we can do the best that we can with our health, following God's principles, and He'll bless us with that. And being transformed by the renewing of our minds, that we can prove what is the perfect will of God. We often seek and wonder what the will of God is, and this is one place that states that. So we are in 2 Corinthians or 1 Corinthians. It talks about our bodies as the temple of the Holy Spirit. And because it is, that should be the highest incentive to care for and develop our physical powers, and to study and understand our body's needs, to act our part in preserving it from harm and defilement. So today we're looking at the continuation of cold to heating. So you're basically doing a hydrotherapy treatment that begins with a cold application, that its application, and it's not necessarily cold, but cool, and its reaction is a warming effect. It causes the body to warm itself up. So there's 4 different types here: the moist abdominal bandage, the partial abdominal bandage, wet girdle, and joint bandage. That's referred to as protected. So moist abdominal is going to be going completely around the abdomen and the back. Partial will be just on the front side. And the wet girdle will be lower just above the hips. And the protection that we'll refer to is basically just applying plastic to it to maintain its moisture content and prolong its heating effects. So the functions and benefits: it's a heating compress to the abdominal area, stomach and intestinal areas. And that is very helpful in a variety of different situations that we'll mention here in a little bit. So basically, you can see the diagram above. It's laid out in layers here. We have individual laying on the bed there, has been wrapped up in a sheet, a wet sheet. So it's not in cold water, but cool water. So it's not going to be ice water, but it'd be cold water. Wrapped in a blanket, a flannel blanket is referred to as a heating pack. The front only is going to be the partial bandage, and also known as a binder pack or a girdle effect. So some benefits of that: it's one of the most functional of the different types of packs that are out there in hydrotherapy land. It's very helpful. Typically, it's used all night. So by morning time, the symptoms should have had some relief, and the pack will be dry, most likely because of the heat of your body. So it's helpful for all atonic forms of indigestion. Essentially, that's atonic means essentially that your peristalsis muscles, the smooth muscles, are not properly moving fecal matter and food matter through the intestinal tract. And it can aid reinitiating that. Neurasthenia, so it's basically irritability and fatigue that's emotionally based. So it can help with that. Liver anemia, insomnia, basically a lack of sleep or inability to sleep. Catarrhal jaundice, which is basically hepatitis that comes from contamination of what you've eaten by fecal matter or other types of fecal contamination. And then constipation can also be aided by that. So drinking water, getting enough fiber, of course, are going to be helpful for constipation, but also it's going to be aiding that peristaltic motion too. So you'd want to have someone you could call if you had a relief of that constipation, because you're kind of secure, and they're like a little burrito inside those cloths and towels. So. So a hot water bottle can be helpful, especially in nausea and vomiting. You can hold it to your body. This person here is holding it close to their abdominal area. It's not directly on their skin. There's a layer of cloth in between, and that's how it wants to be applied. So a protected binder, if you use plastic in the flannel and cloth application, is put over, and it's very helpful in hyperacidity and abdominal relaxation. And it has a greater effect than a non-protected, i.e. plastic over the blanket wrap. It actually, when it's covered with the plastic, there's sweating that occurs, and the heating effect is more pronounced than when it's not covered. So the most often time, we talked about this previously, about doing it on the throat, a throat compress, basically a cold rag around the throat with a flannel and a wool sock over it or something like that, retained, and then overnight your body just dries it right out. You would then end up and basically increase the circulation to the area of inflammation. And that's what you're attempting to accomplish here. So the application, so the supplies you'll need a one thickness of cotton sheet, so like an old bed sheet, or linen, could be cotton or linen. Linen is from flax, or 3 to 4 gauze layers, depending on where you're applying it. It'd be pretty thick, wide gauze if you're doing it on a whole body. So a sheet would be the better, more commonly available resource. 8 to 9 inches wide, depending on where you're utilizing it. You want to have it going half time around the body lengthwise. The flannel layer is going to be placed over top. It's going to be 12 inches wide. It's going to be wider, so it's going to be beyond the actual compress. And longer in length. So you can use safety pins to put it in place and then hold it in place. And if you're going to be doing a heating compress that has sweat associated with it, just a greater heating effect, you'll be using a protected or plastic over top of that. And the diagram there just shows a general kind of a sheet wrap. This is a whole body wrap. Similar, only you would only be doing the torso area for this particular pack. So dip the cloth into cold water. If the person is really, really feeble and they're not going to have enough caloric output in their body to adequately heat up, and they would actually become hypothermic as opposed to warming, then just do the abdominal covering only, or just a small wet cloth, so you can reduce the surface area that the body is trying to heat. You can also use just cold sheets if they're really feeble, that will warm more quickly because there's a lower heat capacity of cloth as compared to water. Water has a high heat capacity. It will stay cold longer and absorb a lot of heat as opposed to other things like cloth. So first put the flannel outer layer on the bed, then put the wet cloth that's wrung out. It shouldn't be sopping wet. It should be just damp, and placed on top, and then lay the person on their back. So the cloth is going to be going from armpits to hips. So it's an abdominal wrap. And this is a kind of a wet sheet pack. In the diagram here, just think about their arms being exposed and going from their hips to beneath the armpits, and tuck the ends under the body as they have that procedure being applied. So you don't need to rush, but just be timely about covering the ends with a flannel cloth. You don't want them to be chilled or cool. You can secure it with safety pins, especially for overnight use, because people tend to move around and lay on their side or change position. And it's okay with the safety pins. You're not going to lose the effect If you have someone who's wrapped in a pack, you want to keep an ear out just in case they do need to utilize the restroom or something like that, and be able to assist them in getting out of their pack. So the flannel should extend beyond the wet by at least 2 inches. So it's going to be overlap beyond that. So protected one, again, is using plastic. You place that over top of the flannel, and that's going to slow the drying out process. Hyperacidity is a time when this is very, very practical and important. So most packs don't use the plastic sheeting, but hyperacidity is a classic one where you would be using it. So sometimes a hot water bottle is placed over the stomach outside the flannel to just aid in accelerating the warming process. So once they have woken up in the morning, it'll probably be dry. The pack will be dry. You're going to wash that area with cold water. Basically, you're quenching it. You're causing the pores to close up because you're going to be eliminating some toxins through the skin. Remember, your skin is your largest excretory organ in the body. And you want to wash it, and you don't want them to get chilled, but it does need to be kind of quenched and close the pores up. So another common name for this is the wet girdle technique, because it is kind of above the hip area in the lower abdominal region. So heating chest pack, it's similar to a chest fomentation. So chest fomentation is basically using a hot water. You can use a hydroculator or some other warming mechanism, or just hot water in the sink and wringing it out, putting it on the chest and repeating that as it cools, especially for congestion and things like that. The main difference is that the wet cloth isn't changed. So a fomentation is rapidly changed as it cools, whereas you're actually going to be the heating chest pack, you're going to be starting not with hot water, but with a cold damp cloth, and your body is going to create that heating sensation. So it's wrapped around the body and covered, and it's a slow heating process over time. So there's some variations to the heating chest pack. You can do a partial chest pack. So in frail people, that would be just the front of the person rather than wrapping around the sides and the back in addition. So basically, when you're doing a whole heating chest pack, you have a maximum surface area that you're utilizing. But if someone's frail and not going to have the energy to put into warming that up, it would maybe cause them to go hypothermic, then you would only do the front side. You can also do a dry chest pack. We referred to that a little before. So just a cool cloth, not moisture present. Again, because of the lower heat capacity of cloth as compared to water. So you don't want to use it for pneumonia, for people who are very, very thin or aged. So you can also use a hot trunk pat, which is the entire chest, abdomen, and hips. So it's going to be a larger area than just the chest. Basically, the heat builds up over time of use. So over the course of the night, or usually you're going to want to have it on for a protracted period of time. A chest pack you can't just walk around with. I've used a throat compress and just worn it all day. That can work in cool weather fine, but it works out best when you're going to be sedentary for a period of time. Overnight's best. So it helps relieving lung and chest congestion, and it's very powerful. It's the most powerful of the packs, the chest pack. Over the long run, but fomentations are more immediately functional. So if you don't have a lot of time, you're not going to be able to sleep. You can just have the fomentation treatment, which is a shorter in duration rather than doing the heating pack. But the heating pack is more powerful and can be used during an 8-hour nap, sleeping overnight. So you can use a partial and a dry are also utilized, but they're not as powerful. The partial is more powerful than the dry. So some areas where there benefit. So bronchial and chest cold. So basically you're going to have chest congestion or mucus in the bronchial tubes, upper respiratory tract. Respiratory flu, pneumonia. You want to use a dry pack only in the early stages and a partial only during a late recovery. So pneumonia is a little bit different. You can have some contraindications if you're using it inappropriately during pneumonia. Pleurisy. In a strong person, you can use the heating pack following fomentations. So someone who has a high vigor, so pleurisy essentially is an inflammation of the lung lining. There is fluid that is, your lungs are inside of a sac, and they move up and down with your respiration. And sometimes that the lung tissue doesn't slide easily up and down inside that sac because there's inflammation, bacterial inflammation that causes it to stick. And it can be very, very painful. So a strong breath, a deep breath can be very, very painful to take. And someone who has pleurisy, it could lead to pneumonia because they're just not taking deep breaths. So there's could be a progression there. But someone who's strong, who has pleurisy, you can do a hot fomentation that can help, and then do the hot pack and then go to bed. A feeble person, you wouldn't want to do the fomentations first. You want to do a dry pack only, or a hot water bottle, versus doing the entire heating chest pack, because they wouldn't have the capacity to warm it up right. Also helpful in whooping cough and croup and asthma. So the heating chest pack can be very beneficial in a variety of ways. So if a person is going to be using a heating chest compress for multiple applications, you can do a fitted chest pack. This is one way of doing that. You can cut strips of cloth that fit that person. You can also make it kind of like a jacket without sleeves, essentially, so that it has cloth that wraps around the torso and the front and back. So the flannel material is going to be covering the cloths. This is actually coming up and over the neck too. Wouldn't necessarily do that, but it could go over the shoulders. So one for over the chest and shoulders and sides, and the second over the back and the lower shoulders and side. So that's going to cover the cloth, and it overlaps under the arm. So you have a double thickness of the flannel, and then the cotton cloth for wetting is used. If you're doing a dry pack, you're not going to be using any of the wet, moist cloth for the heating pack. It'll just be kind of like a torso sweater, essentially. And in fact, it might be easier to apply a two-piece or a multi-piece flannel covering than a sweater, depending on the application. But you could probably use even a sweater if that's what you had. So application, you first want to warm up the person's chest. So you can do that with hot fomentations, or you can use a heat lamp, just a standard heat lamp, that good kind of infrared thermal heating. Wring the moist cloth out completely unless you're doing a dry pack. So you want it to be moist but not dripping wet. That would be excess. And you can use tap water for doing that, just regular tap water, and wrap the chest and upper back. So essentially you have a heating pack. So a heating pack starts cold because you put the lukewarm or the tepid water in the fabric, and then it warms over time. So it's heating. So you're not actually applying heat initially. This is just a terminology difference in hydrotherapy terminology versus just, typically we think of a heating pack as something that you're applying heat with, but it uses your body to do that. So you can add camphorated oil. Plastic, again, increases the effect and can initiate sweating. So sweating would be helpful if you're trying to detoxify and eliminate through the skin some of the causal agents for the congestion or whatever, asthma or whatnot. And then cover that with the fitted flannel, secure but not tight. You don't want to restrict the breathing area for the chest to be able to rise and fall. So then make sure that the cloth is completely wrung out. You want to make sure you're avoiding chilling. You want to snugly secure it again, but not too tight. And you want to have it to be comfortable and feel warm soon. So keep track of your charge so that you know that it's working. If it's not working, take it off and reapply it. So you maybe we'll change the actual way you're doing it. So maybe going from a moist one to a partial or a dry. So depending on the vigor of the person, they may not have the thermal output to do the heating of a completely wet total body wrap or torso wrap. So a partial or a dry may be the best thing to do. So just pay attention. You need to pay attention to the person that you're working with. So a dry heating pack is used during active pneumonia, and a dry chest pack is the best thing to use during pleurisy in the feeble. So again, in the strong, you can use a fomentation first and then a moist pack, but in feeble, just do the dry chest pack. So just a reminder, an important note, most people think of a heating pack as an appliance that applies heat. So you have your heating pad, you push the button or a thermophore and it heats it, or you have one of these little packs with a disc in it that you can flip and it activates the salt. Sodium. It's a sodium matrix that becomes solid upon clicking of the disc and it heats up. So that's a heating pack. But what we're talking about here is not a heating pack, but allowing the body to heat itself for free. Essentially, no power is needed. You just need a stream nearby and some cloth so you can get some water. So the body uses its own energy output just from metabolism. So warm that up, and what that's doing is increasing the circulation to the area. So if it's a chest pack, it's going to affect the heart, the lungs, and abdominal pack, all your abdominal organs, so your intestines, your stomach, pancreas, kidney, liver, all those organs that are in the abdominal area. And it's free. So if you would like to review the steps of the various packs here, just replay or go to preparingforthetimeoftrouble.com to review future and past episodes.